Welcome everyone, dear Chairman. My name is Václav Hołówko and I work in the Department of General Transplant and Liver Surgery at the Medical University of Warsaw in Poland. And today I have a privilege to present you for the first time Polish experience in minimally invasive liver surgery based on a national registry PL MILS. The background of world history of laparoscopic liver surgery, first laparoscopic liver resections in Poland were performed unfortunately almost 20 years after first case reported by Gagner in 1992. Professor Wróblewski with his first cases in 2010 and Professor Budzyński with his first major laparoscopic right hemihepatectomy in 2013 were the pioneers of minimally invasive approach in liver surgery on Polish land. Simultaneously, with increasing popularity in the world of laparoscopic liver resection, which was observed after organizing consensus meetings, reporting first randomized controlled trials about laparoscopic liver resections, and especially after associating surgeons around the world and sharing their knowledge through International Laparoscopic Liver Society. Also in Poland, slowly but successively, laparoscopic liver resection was gaining popularity with more surgeons involved in performing such cases. Due to this fact, in June 2020, we decided to organize and start with a national registry, which is held under auspices of Association of Polish Surgeons. Main aims of this registry was to assess the evolution and expansion of minimally invasive liver surgery in Poland, to evaluate the short and long-term results of laparoscopic liver resections performed in our country, and to prepare the background for prospective studies on laparoscopic liver resection in Poland, and also hopefully in cooperation with other countries. We started with sending an invitation for cooperation to every surgical department performing liver surgery in Poland, and also publishing it on the Association of Polish Surgeons website. Each participating center uploads their data through RedCap software, which is then securely stored on the server held by Medical University of Warsaw. Finally, there were 7 centers which accepted the invitation and shared their experience in laparoscopic liver resection. To the best of our knowledge, these are all surgical departments in our country where minimally invasive approach is applied for liver surgery. After 2 first centers in Warsaw of Professor Wróblewski and in Krakow of Professor Budzyński, in 2017 and later, next surgeons started to perform laparoscopic liver resection in Lublin, Bydgoszcz, Białystok, and Łódź. Until the end of December 2020, we performed together 313 laparoscopic liver resections. The volume of cases differs among centers. However, 2 leading centers perform laparoscopic liver resections for significantly longer. Fortunately, we observed an increasing number of cases performed per year, which is more exponential than linear, and we believe that plateau is still far ahead of us, so we may come closer to volume of laparoscopic liver resections observed in other countries with well-diffused laparoscopic liver surgery. Patients scheduled for laparoscopic liver surgery in Poland had median age of 63. They were rather free of severe comorbidities. Almost half of them had a history of previous surgery, open or laparoscopic. However, only 2 were scheduled for a laparoscopic re-resection. Malignant tumor was an indication in around 75% of all cases, while the most common localization of tumors were anterolateral segments. Being aware of different difficulty of laparoscopic liver resections, most were resections which would be classified as group 1 in accordance to Institute Mutualismus reclassification. It is worth to underline that vast majority of laparoscopic liver resections in Poland are performed by 10 different surgeons who are still on their learning curve. Most common additional procedures during laparoscopic liver resections was intraoperative ultrasound and cholecystectomy. However, also advanced procedures such as lymphadenectomy or ICG staining were performed. Most commonly, We use 5 trokers for resection, and the most preferred instruments for parenchyma transection are CUSA and harmonic knife, with accompanying clips and staplers. Wrinkle maneuver was performed in almost half of cases with median total time of 40 minutes. It is worth to underline that strategy of performing Wrinkle maneuver differs among Polish surgeons from reactive to bleeding to more prophylactic. Median procedure time was 235 minutes. Median blood loss was 200 milliliters. Conversion rate was rather low as for a learning curve, which was 8%. 13% of cases needed intraoperative red blood cells concentration transfusion. After resection, we evacuate specimen most commonly through widening one of trocar incision and left drain in almost 80% of cases. Most common histopathological diagnoses were colorectal mets. Usually patients presented with solitary tumor of median diameter of 30 millimeters. Non-radical resection was assessed in almost 30.5% of cases. Median postoperative hospital stay was 5 days. Complications were declared in almost 13%. However, noticeably low morbidity rate may be influenced by retrospective character of the study, especially by underestimating complications grade 1 and 2 in accordance to Clavin-Dinto classification. Most common indication for 30-day reoperation was biliary fistula. Only 3.2% of patients need to be readmitted to the hospital within 30 days. Long-term results are still ahead of us due to the short period of long-term follow-up and heterogeneous group in accordance to histopathological diagnosis. But to sum up, this study is the first national report about expansion of minimally invasive liver surgery in Poland. It is very promising that minimally invasive liver surgery programs in Poland are rising, especially in the last 3 years. And what is the most important, maintaining the safety and efficacy on widely accepted level. Thank you very much for your attention.